Welcome to episode 3 of fever. In last 2 episodes, we have discussed normal body temperature, thermoregulation, influencing factors, how to measure body temperature for clinical practice, different fever, hyperpyrexia, hyperthermia, hypothalamic fever terminologies, pyrogen and pathogenesis of fever. Today, our topic of discussion is approach to a patient of fever and treatment of fever. Now, for any fever patient, clinically, we have to take proper history of the patient. With history and chronology, we have to understand clearly the perspective of the fever, like exposure to vector, drug history, particular endocrinological feature, any focal symptoms which help us for diagnosis, vaccination history, previous medical history and etc. and etc. So, this history is very much important. For analyzing any fever, we have to keep our temperature records for that patient. For recording temperature, we have to use a particular device and we have to measure temperature from the same site, such as for one patient we are measuring regularly oral temperature. So, always we have to measure oral temperature to analyze that patient. After taking proper history, after clinical examination, we have to proceed for laboratory investigations. For diagnosing any fever, the basket of laboratory investigation is really vast and immense, but there are few basic investigations which we should mention here. Number 1, we have to take a clear WBC count with differential count for that patient. In differential count, we have to find any juvenile or band form, any toxic granulation and any Dole bodies, whether present or not. What are toxic granulations? Toxic granulations basically increased number of granules with increased staining in neutrophils. And what are Dole bodies? Probably Dole bodies are old remnant of endoplasmic reticulum. So, these toxic granulations, Dole bodies, juvenile or band forms are indicative of infections in the body. CRP, C-reactive protein and ESR is having immense role in analyzing any fever. Most of the fevers are self-limiting when it is viral, but whether we are missing any occult disease, we can understand from persistent elevation of ESR and CRP. Sometimes we are measuring interleukin level, but Interleukin 1, interleukin 12 measurement is of not that clinical significance, because their level usually is not parallel with the severity of the disease process. But interleukin 6, sometimes we are measuring it, particularly in COVID era, we have measured interleukin 6 to assess cytokine storm in those patients. Acute phase reactants are of immense value in analyzing fever. There are two types of acute phase reactants: positive acute phase reactants and negative acute phase reactants. What are positive acute phase reactants? Phase reactants, that means proteins produced from liver, which are getting elevated due to any inflammatory process in the body, infectious or non-infectious, are known as positive phase reactants. And what are negative phase reactants? Negative phase reactants are proteins which are at least decreased by 25% in the body due to inflammation. Those are known as negative phase reactants. Now, important positive phase reactant are like CRP, ferritin. These are important positive phase reactant. Negative phase reactant, important negative phase reactants are albumin and transferrin. Very often we are coming across with the patients having high CRP, low albumin. In that case, these albumin CRP are phase reactants which are very important. Just I am showing you one photograph of different phase reactants. Now, positive and negative acute phase reactants. Positives, we have an interesting mnemonic MHC3AF2A. M means mannose binding protein, H haptoglobulin, C3 CRP ceruloplasmin complements, A for alpha 1 antitrypsin, F2 ferritin fibrinogen, and A for amyloid. So, these are important positive acute phase reactants. Now, negative acute phase reactants T3ARA, that is transthyretin, transferrin, transcortin. These are the T3, A for antithrombin, R for retinol binding protein, A for albumin. Out of all these, in clinical practice, most important positive phase reactant are CRP and ferritin, what we are doing regularly, and negative phase reactants albumin and transferrin we are doing regularly. So, my dear friends, regarding acute phase reactant, we will discuss it in a different episode, but during evaluation of fever, the message is acute phase reactants are having immense value. So, approaching a patient of fever, history, clinical examination and laboratory investigations are very important. Now, we will discuss treatment of fever. For treatment of fever, first we have to understand whether we will use antipyretic or not for the treatment of fever. A clear message: there is no contraindication in using antipyretic in febrile episode. It is not at all proved by giving antipyretic if we reduce temperature of the body, the infection or inflammation will be uncontrolled, and parallelly it is also not proven if we do not give antipyretic, fever will facilitate the resolution process of the inflammation. So, there is no contraindication of giving antipyretic, but there are few situations where we are withholding antipyretic. Number one, where we are not getting any clue, particularly all cultures are negative and empirically we are using antibiotics. In that case, whether patient is improving or not, whether antibiotic is working or not, to understand that one, we are withholding antipyretics. Next, sometimes in some patients we are getting temperature pulse dissociation. With the rise of temperature, usually pulse rate rises, but in some diseases we observed with the rise of temperature, pulse rate is not rising or showing relative bradycardia. As for example, typhoid fever, leptospirosis, brucellosis, etc. So, in this condition sometimes we are withholding antipyretics. There are few situations where fever is there or very low fever is there, like neonates, elderly patients, hepatic dysfunction, renal dysfunction, patient is on steroid. In these conditions, patients are not having proportionate fever to the underlying inflammatory process. In that case, chances of hypothermia is very high. So, in that case we should use antipyretics judiciously. Sometimes we have to understand pattern of fever. To understand pattern of fever, sometimes we are not using regularly antipyretic. Now, there are diseases where we are getting classical patterns of fever. As for example, in Plasmodium vivax malaria, we are getting fever every third day. In Plasmodium malariae, we are getting fever every fourth day. In relapsing fever, like in Borrelia, we are getting a duration of afebrile followed by a duration of febrile episode. Another fever is there which is known as pale Epstein fever. Here 3 to 10 days of fever followed by afebrile episode of 3 to 10 days, and it is found in Hodgkin's disease and other lymphomas. Another pattern of fever we are getting where every 21 days interval we are getting fever with neutropenia, that is known as cyclic neutropenia disease. So, these are different patterns of the fever, and another pattern of fever is periodic fever, where we are getting fever for a period of time followed by a gap of afebrile period. These are periodic fever. So, periodic fever example is like familial Mediterranean fever, TRAPS. These are different periodic fever or periodic febrile syndromes. So, for understanding different patterns of fever, sometimes we are using antipyretics very judiciously. Another pattern of fever is there which is known as recurrent fever. What we are getting usually in autoimmune and autoinflammatory diseases, including inflammasome disorders. So, here febrile recurrence with an episode of afebrile period is there. So, there are different patterns of fever every third day, every fourth day in malaria, relapsing fever in Borrelia, Pelefstein fever in Hodgkin's disease and other lymphomas, periodic fever in familial Mediterranean fever and TRAPS, recurrent fever in autoimmune and autoinflammatory disorders. So, and cyclic neutropenic fever, where we are getting every 21 days interval with neutropenia. So, there are different patterns of fever. Now, we are trying to understand mechanism of action of different antipyretics. Before entering into the mechanism of action of antipyretic, today we are stopping here. In the next episode, we will understand mechanism of action of antipyretics and different regimens of fever. Thank you, and we will meet in next episode.